savings, collaboration, and the scalability helps us to do better medical plan in the patients. Next. The remote patient monitoring is also easy by continuous health tracking, reduce hospital visits, improve compliance at the emergency alarms. Next, the nanotechnology in medicine is targeted drug delivery. In many diseases, we do the nanotechnology, treating them on time, and the nanoparticles deliver medication directly to the affected cells, and the cancer treatment and the diagnostic and regenerative medicines are into the nanotechnology. Next, the wearable artificial organs I have already told you, like portable dialysis machines, artificial pancreas, heart pumps, challenges. These are all on the way. And in type 1 diabetes, who needs multiple doses of insulin daily, practically they are assisted to insulin pumps, where the delivery and the treatment is very easy with the pump therapy. Next, the automation in the diagnostic has taken place. AI-powered pathology, point-of-care testing, lab efficiency and integration with electronic health records. Next, the challenges in technology adoption are many. Next, the smart hospitals are what they have internet of the integration, the automated workflow, energy efficiency, patient-centric design, and I'm sure a hospital like Padmini will be a smart hospital, and very soon, you see, there is no meaning in fighting with our students who are not coming to our classes or the medical wards. I analyze myself. 20 years back, 15 years back, 10 years back, I had one-to-one interaction. Why I am not wanted by my students? Because the technology is advancing, and along with clinical medicine, the technology has to be incorporated. So at SCB, along with the traditional teaching and bedside teaching, we incorporated workshops for our medical students. You will be astonished, in just 15 minutes time, 270 posts which were declared for registration of the workshop were filled up, paying a nominal charge for the workshop, which included a surgical stitch, third stage of the labor, interpretation of a ECG or X-ray, and different technologies like removing a foreign body from a child who is respirated, different technologies like trauma management in the ICU. We conducted 8 workshops, and they are so largely attended by medical students not from SCB, from East India. It's an example that what our new generation are wanting. So we are all shifting towards technology, towards very targeted, focused therapy, and we have to get prepared for that. Next, the bioprinting. This is what the bioprinting and the organ engineering, which has 3D printing issues and customized organs, and the future transplant reduces the dependency on the donor. So this assures you a HLA matched transplantation. Next is the augmented reality in surgery. I have already talked about the real-time guidance and training stimulations. Next is the genomics and the CRISPR. Next, the exoskeletons for mobility. Those who have disability and the accidents, the assistive devices help patients with paralysis or mobility in the impairment. The rehabilitation support like strengthening muscle through the guided movement. They are not just prosthesis or supportive desires, they are the exoskeletons for a patient. Next, the digital twin healthcare, virtual patient models and the predictive analytics and the surgical planning. Next, the neurotechnology, you see, interfere, it restore the communication for the patient with disability. Even patients of Parkinson's disease, we have chips in the brain which can be controlled from the outside. You know about the pacemaker and the cardiac function. Next, the sustainability in the medical technology is much better. I have told you about the eco-friendly devices, energy conservation, waste sustainable packaging. Next, the technology in pandemic response, we saw during the COVID time how beautifully we can integrate the whole world in public health communication, vaccine development, rapid testing solution, and contact tracing. Next, the ethical consideration in medical technologies, last part. I told about privacy of our patients and ethical consideration. And that also privacy concerns are taken care, AI bias is taken care, assisted informed consent is taken care. Next, the road ahead of technology in medicine is integration of AI to Internet of Things, the global collaboration and focus on preventive care, continuous learning. Next, so the last thing I'll tell you that 10 years ahead, we see a hospital, a consultant, a specialty completely derived on technology, where we have a challenge of lifestyle and the problems increasing. Especially related to the metabolic medicine, I'll tell you that the diabetes is increasing. From 70 million, we have now 111 million patients of diabetes in the country and 136 million patients of pre-diabetes. That tells the obesity is increasing. Recently we had World Obesity Day. We saw India is going to the obesity capital of the world. Now India is in number 3 after China and US. And another 10 years will be obesity capital, heart attack capital, diabetes capital, and all metabolic disease capital of the world. So in one hand, the healthy lifestyle. Any good school you go, you see 50% of the students are obese and have insulin resistance in the form of acanthosis nigricans or increased OMA. That we have evaluated. So in one hand, the civilization is getting reached, the lifestyle is changing, sedentary lifestyle, no efforts, the first food by Zomato and Swiggy, and people are moving towards pandemic of the metabolic problems including diabetes, hypertension, obesity and heart attack. In other hand, the technology is improving and whole medical science is encompassed with the technology looking to the future. So this is the day you make your clinic a digital clinic or technology savvy clinic. That's what you can attract patients and help patients better. When there is a point of care, you can do a blood glucose test, lipid, uric acid, A1C, you can do a assistance, you can empower patients. When our patients are asking us, sir, how can I change my insulin? How can I go for the diet? How can I change my lifestyle? Many of our old-timer consultants are irritated. They are telling you, eat what I have written. You have no business to discuss the treatment with me. But that will not last more. This is the time we have to make our patient empowered, give them the way how to control their own problem, make them part of the technology and make our clinics and hospital technology based, which will bring a change. And if you cannot do, you will be simply rejected by the patient, rejected by the society, rejected by the profession. So this is now a junction for the people who are wanting to render the health care, and I am sure the DRIEMS group, the Padmini hospital will be a technology savvy hospital, and very soon we have to incorporate all what I have shown you into our practice and the patient care and make the paramedical, the patient and the professionals a part in the health care. I thank again for the invitation of this talk and wish all of you to take a single message: be digital savvy, be technology savvy, be good clinicians, but update yourself and let us help out the cause of patient care. Thank you all.
I think Professor Jayanta has given an exhaustive possibilities that is possible for the medical students sitting here for their future practice. And we are really proud to have him here. And although I missed the first part of the talk, it was very impressive to see that he covered everything, including my topic, which is orthopedics. And he enlightened us with the possibilities that is going to come in the future, not very far future, near future, for all our practices. Thank you, Professor, for that.
So, Panda, I have a question for you. When you see a diabetes patient telling that you are lifelong a diabetes, but nowadays some people have started, especially qualified doctors, diabetes reversal program. In 5 days they stop insulin, they stop all oral drugs, and the patient tells that having fasting of 312 and prandial of 404, and now I'm having it 80 and 130. So what's the beauty behind this diabetes reversal program? I don't feel if they are true and they are correct in their statement.
Very, very nice point, sir. Very quickly I'll answer in the interest of time. Diabetes has met everyone already because in spite of all the technology, the patient number is increased in geometric progression. Regarding the cure, we have just 3 words. One is reversal, what sir told. One is remission, which decreases the disease load for some time. And third is relapse. So reversal is not possible. What rightly Dr. Marana, my senior colleague, my mentor, has prompted. Reversal of this disease is not possible if you look into the pathogenesis, that we have decreased beta cells, we have insulin resistance, and especially in type 1 when there is no beta cell at all. Remission, that too in type 2 diabetes, banks on 3 things, and it is possible, sir. For your information, remission in type 2 diabetes is possible, and the first thing in remission is lifestyle. This is lifestyle, lifestyle, and lifestyle. Proper diet, high fiber, low calorie, and carb control. We are carb eaters, carbohydrate eaters. We take 70% of our calorie from carbohydrate. That needs to be increased to 40%. So we need a carbohydrate control. We need to take more fibers, walk at least 30 minutes a day, sleep at least 7 hours a night, and no alcohol, no cigarette, no stress, and good lifestyle promotes diabetes remission. This aims in the weight reduction, and if you approach in the weight, which is your height in centimeter minus 100, then for practical you will reach a normal A1C, normal blood glucose, if you have a beta cell reserve. This has become possible. We have achieved in the patient, and you can talk to patient regarding remission of diabetes. And if they fail to do it, there will be a relapse. The second thing in the remission is a bariatric surgery. We have different procedures. Running bypass, we debulk the stomach, we do a intestinal anastomosis, we decrease the absorptive surface, and thereby decrease the weight. All aim at decreasing the weight, decreasing the calorie delivery, and bariatric surgery has succeeded in a remission. The third thing is on the way, is a stem cell transplant. That is also not far. That is in the phase 3 of the trial. We have done the beta cell transplantation with the pancreas, and we have enhanced the insulin secretions. So if you practice a good lifestyle or stick to the bariatric surgery, decreasing weight and the insulin resistance, or you can go for a beta cell transplant, there's a possibility that diabetes will be cured or diabetes will be remitted.
Recently, one publication from the Google, last year, there is a 3 Nobel Prize going to Google. One is medicine, they are not engineers, they are not doctors, they are all engineers.
mRNA.
Yes. One is chemistry and two is this thing from UK, Google employee, got the Nobel Prize in medicine. This is one publication from the Google, it has come, and fortunately one of the colleague of my son, this thing, if you take all the mix up, how you take the food, carbohydrate, protein and fibers, that is one part. Second thing, first you take the protein, then you take the fiber, then you take the carbohydrate. This is the glucose level in the body, they monitor. That is drastically change. If you take first carbohydrate, then take the fiber, then go for the First you take the protein, then you go for fiber, then you go for the carb. This there's a drastically change in the glucose level. They have manufactured publication by Google one as the engineer.
Sir.
So what is your opinion?
Yeah. Sir, this is all regarding the glycemic index. We have a term called glycemic index, where the basic principle is how long after you consume something, your blood glucose goes high. If you take juice, immediately your blood glucose is high. If you take the whole fruit, it takes time to go up. So the ability of fruit material to increase the blood glucose very fast is the high glycemic index. And what we promote is low glycemic index diet, which are protein rich, which are fiber rich, and which are not very simple carbohydrates which just shoot up your blood glucose. But unfortunately today's diet, what you see, is a polished carbohydrate, and they are not rich in fiber, they are not raw, and they do a very high swing of the blood glucose immediately consumed. What our children are asking in the Zomato and Swiggy, this all low based, when there is polished carbohydrate based diet, that goes on increasing the blood glucose very fast, and that excursion of the blood glucose damages the pancreatic beta cell, which cannot accommodate for the insulin secretion, and diabetes deteriorates. So it has a reason, sir. We should have protein first, fiber snacks, and then carbohydrate, which increases the blood glucose very gradually, and its overall carbohydrate content or our calorie from the carbohydrate should be less than 50%, and worldwide in most countries this is just 40%. In India it is 70%, what has been proved in the STAR study.